The federal government has approved the disbursement of 32.9 billion naira under the Basic Healthcare Provision Fund to strengthen Nigeria's primary healthcare system. Coordinating Minister of Health and Social Welfare Professor Muhammad Ali Pate unveiled the BHCPF 2.0 revised guideline, which aims to ensure equitable, efficient, and transparent healthcare delivery nationwide. The revised guideline increases quarterly allocations to cover operational costs, staff incentives, emergency care, and essential medicines. The minister disclosed BHCPF has shown remarkable progress with a fourfold increase in primary healthcare utilization, recording over 80 million patient visits in the first half of 2025. He says maternal outcomes have also improved, with a 12% reduction in maternal mortality and 92% immunization coverage achieved in northern states under the integrated measles, rubella, and polio campaign.
We're seeing steady increase in utilization of primary healthcare. In the first 2 quarters of 2025, more than 80 million visits to primary healthcare centers have been recorded. These are visits in Nigeria. That is more than fourfold increase compared to 2023. We have also seen huge increase in the outcomes that matter, whether it's skilled birth attendance, immunization in the BHCPF facilities compared to non-BHCPF facilities. In addition, we are commissioning a mini demographic and household survey, which will give us good survey data in 2026 as to the direction. We're seeing improvement in terms of maternal mortality, 12% reduction at least compared to 2023, based on facility data that was reported. But that is not enough to say that that is applicable across the country. But the mini DHS will tell us if the direction is heading the right way so that we can double down, because that's the only way we can reduce the abysmal statistics. It's not about complaining that things are not going right. There are things that are going right. So let's support them. Let's continue to move in that direction. And the media has a role to play in educating our people to know where and how to access those services. In addition, we've seen that the recently launched integrated measles and rubella, polio, non-neglected tropical disease campaign that aimed to reach 106 million children 0 to 14 years in Nigeria. It's already exceeding its target. We had aimed to reach 106 million in all the states of the country. We flagged off for the northern states, and we already have seen more than 92% uptake for measles and rubella in the northern states so far, exceeded the target on polio, and all the targets, including for treatment of neglected tropical diseases, we're seeing improvements. So that is very positive news, but it is testament to the collaboration that exists between all actors in the health sector, federal government, states, civil society, our development partners, and Nigerian parents and the health workers themselves who are out in the front lines also helping to build this momentum.
Dr. Isaac Adekunle Salako, Minister of State for Health, pledged to collaborate with the National Assembly and other stakeholders to further increase investments in primary health care.
And what is that bringing out to us is that it means that we now need to work to expand and increase the fund that's available to BHPS so that more facilities in Nigeria can get the funding. And one of the key resolutions from this meeting is to work with the legislative arm of government and other arms of government that are relevant to ensure that we harvest all opportunities to increase funding that is available for basic healthcare provision in Nigeria.
UNICEF representatives also reaffirmed their commitment to scaling up BHCPF interventions for women and children across the country. With this significant investment, Nigeria's healthcare system is poised for a major transformation, improving access to quality healthcare services for millions of Nigerians.
where every different gateways, departments from the Ministry of Health, states, leaders from the state, leaders from different development partners, we take on the agenda related to the BHCPF fund and its implementation. It's very clear from all the presentations that the Ministerial Oversight Committee has seen that the BHCPF has been very effective, not only from 2023 to 2024 and 24 to 25, but also from the previous quarter to this quarter. And the figures are very impressive. It is working. The challenge now is how do we scale it up in a larger scale, and there are plans to move forward with that. And as development partners, we'll be supportive of the initiative. And from UNICEF side, what we would like is for these to be scaled up so that every woman and every child in Nigeria has access to reliable and high quality health care. And we see a positive direction in that trend, and we hope to see it moving forward. Thank you.
Other stakeholders, including Dr. Tomi Koka, Ogun State Commissioner for Health, and Dr. Pavel Utsu, amongst others, praised the initiative, highlighting the importance of evidence-based decision-making, strong accountability, and unique patient identifiers like the National Identification Number in improving data quality and accountability. Comfort Olayinka, DCTV News.